Well, we're here again with Dr. Vaske from Denver, Colorado, an optometrist. Hi, Dr. Vaske.
How are you doing today, Helmut?
Good. Dr. Vaske, look, what can people who kind of start getting nearsighted, they need glasses when they read, what can they do rather than buying glasses and putting them on and off and on? What other options are there available for them?
If you start to wear glasses to help you improve your distance vision, which is what nearsighted is, then there's possibility of contact lenses. That's an option. Or there's the glasses that have a bifocal in them, so you can see far away and see up close. Those are the two main options in helping you see all those areas.
I see.
Kind of help you out.
Okay, and the third one would just reading glasses and put them on and take them off, right?
Right. Yeah, the reading glasses part if you need to see the up close.
Okay. All right.
If your vision's good far away and you need reading glasses, then you just put on the reading glasses.
Okay. So there is, however, no surgery for that particular dilemma, is there?
There is a surgical procedure called conductive keratoplasty, or CK, which is a non-invasive type of surgery, but it's a surgery that improves your ability to read. It's called monovision. They usually just correct the one eye for reading up close and then keep the other eye for far away. That's one possibility. If your vision is really good far away, then there is that option.
I see.
But
I see. Is that a good option? I mean, is that something people who just don't want to wear glasses and don't want to wear contact lenses? Is it a good option? Is it a lasting option? Is it an affordable option? Is it an option where the side effects are not so huge that you regret it later? Tell us a little bit more about it.
Yeah, it's an option, but with a big but on the end. And so there's some nuances that can go on. It's about $3,000 to do one eye. It doesn't last forever. You have about a 4 to 7 year window of not wearing any reading glasses. So it's to keep away the reading glasses for that period of time is that kind of a little investment to do to free up your ability to see at all different levels. But the main thing is your lack of depth perception. Since you're only seeing out of one eye for the distance and only seeing one eye for up close, then your depth perception is going to be confused a little bit, and that can affect your driving at night, which can be disconcerting to people, make you feel uncomfortable driving at night. And all the headlights look different. You're parking a car, you're going in the garage, you could have accidents, even the stoplights could look at different levels, and you could be stopping short or going through stoplights or stop signs just based on your lack of depth perception. So is that something people adapt to?
Yeah, no, I think that doesn't sound reasonable to me. Like, most likely, I assume, and tell me if I'm wrong, the people who start needing reading glasses are, they're becoming 50 and more, or 40 and more. Anyway, they're not youngsters on an average, right?
Right.
So not having a depth perception, like for instance, a few days ago, I stepped out in the evening. It was raining from a walkway to the parking lot, and somewhere along the line, I misestimated the step, probably by a few inches. There was no curb going on, and I thought there was.
Right.
I almost fell. Now, I don't think you want old people to fall.
No. There's other problems that can arise from that, definitely.
Right, so that doesn't look like a good thing. So it's obviously not done too often, I assume.
It's not very popular, but it is available.
I understand.
So at least there's something out there, yeah.
Okay, I got it. Now, and so if a person wears glasses, not glasses, that's a pretty normal thing. People know about that, but, contact lenses, and of course they know about it too. But so if they take contact lenses, so they're only for reading, but they're in all day long, right? Even though you only need them really for close-up reading and doing close-up things.
With the contact lenses, there's a couple different ways to do that. One is like we did with the CK is monovision. The other way, which is called simultaneous vision, is trying to allow or have a contact lens that helps you see far and near altogether. So it's a new, or it's not new, it's been around a while, but it's getting to be more popular because of the problems with having monovision. The lack of depth perception, just having the one eye for far, one eye for up close. So these multifocal lenses help you see at different levels for far away, your computer, and up close out of both eyes. So you have a better field of view looking through those lenses. Your eyes will change automatically every 2 to 4 years. So as the need for reading starts to become more and more advanced, you can change the lenses with you, and so you can kind of improve your distance vision, improve your near vision on the fly with your annual exams.
Wonderful. So basically then those lenses are built the same way that you described the bifocal glasses, and they automatically, the lenses go and give you probably a slightly better vision far away, or at least keep your good vision and give you a better vision near.
Right. And it's very unique design on all those different lenses, and you can work on your dominant eye, your non-dominant eye. Every company, every manufacturer has their own little nuances, and you can really fine-tune the powers of the lenses to match your visual needs.
Got it. I got it. That's wonderful. So you can work with it. And other lenses available. I know that in a normal lens, with normal lenses, there are lenses available which you change every day, which you change, I don't know, once a week or whatever. Is that the same thing with those lenses? They come in all shapes and forms, and whatever, fits the liking of a person better, or the eye, whatever the eye can tolerate better is available?
That is correct. From the one-day lens option, you throw it away every day, to the reusable lens, you keep it around for a month. There are even the lenses that you can keep in overnight for a week at a time. So you don't have to take it out every night, which is very convenient for a lot of busy people.
Sure. On an average, would you say that they take out every day or every week, or they take out at least in the evenings versus the one living in for a week? On an average, that they would be better for the eye, that the eye breathes again, or whatever that might be. I don't know. What do I know?
The average individual will take the lenses out. Say 80% of my patients that are wearing contact lenses do take the lenses out every night. It's just this foreign object in your eye. Even though it may be approved for overnight wear based on the type of material, because it has passed all these regulations by the FDA. But again, this is this foreign product that can cause eye infections, and then who knows what can get on that lens throughout the day, and even just by rubbing your eye, and then if you go to sleep, there could be some problems just by that. Okay. So most people, just as they've been wearing contact lenses, it's an easy transition that it's just kind of the routine. They take the lenses out and clean them and just keep them around for the month and then throw it away.
Okay. I'm just very leery about that, because personally, I don't think I've ever yet gotten an eye drop. I hate that stuff. I close my eyes when I jump in the water, when I jump in the shower, you know what I mean?
Yeah, contacts, it's a vast... It's not an everybody's type of game. Sometimes it seems like the concept is great. Just ask a lot of these teenagers that say they've watched their brother, sister, family member, and they come in and say, "Oh yeah, I want contact lenses," and then they get that finger, near your eye, and then it's closed. Okay, it's closed. Okay, well, it's not gonna work.
Right.
So,
okay. But there is a solution. There is a solution, and that's good to hear. There are so basically there are the lenses which can be taken mono. Many you do it in one eye, the other one stays there. But then you have the depth perception. So I think one should stay away from that. It makes sense to me. Yeah. Then there's the one which is near side and far. Then you have just the reading glasses, which you have to take on when you read and not. And then you have the reading glasses / the bifocal one, which you can keep on all the time. And stuff. And then you still have the surgery. Again, you have the problem with depth perception plus the money, and in about 4 to 6 years, you've got to redo it again anyway. By the way, can you redo it again then if you want to? Let's just say you liked it. Can you then redo it?
Nope. It's one and done.
It's one surgery and it's done.
That's exactly. Yeah.
Okay. Well, good.
So,
well, I'm sure this was very informative to people. I hope so at least. And we'll ask you more questions, Dr. Vaske. Bye-bye.
Bye-bye.